Okay, here we go. Recording started. And here we go. We're gonna start with the first station. And we need the first candidate to take on this first station. Who's first?
I can start.
Dima?
Yes.
Okay, Dima. Let's start. I'm gonna send you the reference right away.
Okay. On the group, right?
Yes.
Yeah.
It's not our cases today are not so tough, honestly.
Yeah.
They are manageable, but they need like some concentration, of course,
Yeah, I was trying.
as you will be doing in the exam. I shared it and you should have it within a few seconds. Yeah, here we go. You got it? Found it? Hello? Hello?
Yes, I just 1 minute. You give me okay. Okay. Yeah.
Sounds good. Okay. Is that watch the time or?
Yeah, you can start. You can
Okay,
start.
Nizam, can you watch the
Okay.
time?
Yes, sir. Just 1 sec. Okay, go ahead.
Hi, I'm Dima, the pharmacist. How can I help you today?
Yes, I have a new prescription. I would like to dispense it.
Sure, it's my pleasure. Could you have a seat in our private counseling area? Make sure whatever we discuss will be kept confidential. Can I confirm your name and age?
Yeah, my name is Kamala Harris. I'm 56 years old.
Okay, nice to meet you, Kamal. How are you so far?
I have a back pain.
This must be concerning for you.
Yeah.
Okay, this prescription for you.
Yes.
Okay, does the doctor so that's for low back pain?
Yep.
Okay, does the doctor mention anything about this medication?
What do you mean?
Like, does he tell you how to use this medication? Give you
Yeah, he told me the pharmacist is gonna tell you, but he told me that I have to take it like before meals, twice daily for 2 weeks. Both he prescribed me 2 things.
Okay. Kamala, may I ask a few questions to assess your condition?
Yeah, sure. You
Okay.
have my file here in the pharmacy as well.
Okay.
Mhm.
So I can see you are in Actinol, 35 milligram for osteoporosis, right? Low bone fracture. Do you take this medication as prescribed?
Yes, sure.
And dexlansoprazole
Yeah,
and vastatin for
correct. Yeah,
okay, and calcium carbonate.
correct.
Okay, and Gofresel plus for hypertension.
Yeah.
Your blood pressure is normal. It's
Yes,
controlled.
it's fine. It's yeah. More or less, it's good.
More or less, it's good. That means it's low.
No, it's fine generally. Yeah.
Amlodipine, same. Blood pressure and ranitidine. You have 2 medication for gastric pain.
Yes.
You still use it, both of them?
Yes.
Okay. And Celebrex, 200 milligram. It's inactive. You not use it, right?
Yes.
Okay.
Correct.
Does you mention that for your doctor that you take both medication for gastric pain?
Yes.
Okay. Okay. Aside for this medication, do you have any other medical condition? Any prescription
No.
medication? Any other
No.
medical condition?
Other medical conditions? No, I don't have.
Prescription medication?
No prescription. Everything I told you can find it in my file.
Multivitamins, herbals?
Yeah, I'm taking like some over-the-counter medications.
Such what?
Which one? I'm taking multivitamins and I'm taking Robax, the one for the back pain.
Mm-hmm.
And that's it. It's everything.
Multivitamin, you take it from yourself?
Yes.
Like, okay. For general health, right?
Yes.
About your lifestyle, do you smoke?
No.
Do you have time for exercise?
No.
No exercise. Do you do you follow any
I'm
specific
using Voltaren. I'm sorry. I'm using Voltaren gel as well. For
and
exercise, no, I'm not exercising.
so you use it Voltaren and Robax and multivitamins, right?
Yes, like over the counter. Yeah, correct.
Yeah, I will update on your profile. What about your diet? You follow any specific diet?
No, normal diet.
Alcoholic intake,
No, occasionally.
occasionally. Caffeine intake?
No.
No. That's good. You have a good lifestyle. Keep it up, except exercise. I will address that in later. Okay, Kamal, let me check my reference and come back to you. Do you have any question or concern? Shall I add this while I'm checking my reference?
No, thank you.
Okay. Mhm. Okay. Can I see the prescription, please?
2 minutes.
Okay, so the doctor prescribed for you medication called Vimo. This have two active ingredient, naproxen 500 milligram. It is for relieve your pain, and esomeprazole 20 milligram for gastric protection. But I have a concern here regarding your medical profile that you have same class for which is omeprazole. Okay, it's called omeprazole. It's the same class. And so you need, I will fax the doctor Aranitadine as well. I will fax the doctor to let him know about it. And as I will recommend it to you to stop both medication because you no need to double medication. So this medication you're gonna
Which two medication that I
just
have?
let me, the other medication. Let me check your profile. It is Dixlant, dexlansoprazole, and ranitidine. You need to discontinue both of medication because you have the same medication in your new medication. Okay?
I have the same medication and the new
The
prescription.
same classes, I mean the same classes
Okay.
and the same the working. So no need to double medication in your profile. No.
Okay.
Okay, so you will be exposure to like overdose from medication and over side effect. So you're gonna take one tablet daily 30 minutes before breakfast and supper for 14 days. Okay, and also you have to taking an empty stomach. Try to be 30 minutes before the food.
Okay.
I have also concern regarding over-the-counter medication, Robax. You use it for back pain. Also, they have same side effect, same
Time out.
too much profile.
Okay. 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 Sounds good. Yeah, you did well. However, you had to be like more efficient in the process. I'm gonna tell you why. But you missed as well some of important questions, honestly speaking, during your during your assessment.
Okay,
Get
that's
me?
your,
Yeah, yeah.
oh, yeah, that's your gastric pain. You still control or not? Because you have two medication. Okay.
Let me tell
Yeah.
you after like we're done. I like to redo the station, honestly.
Okay.
But you know, because you did well. In general speaking, you did well. But you spent so much time in
Because
reading
the
the
profile
profile.
is too
Yeah, yeah,
long.
yeah. But you could have done it like more precisely like that, concisely like that than
Okay.
that. But anyways, would anyone would like to retake it?
Okay, thank
First?
you.
Yeah, I will tell you, Dima. I will tell you everything. Anyone would like to retake the station, guys? Nobody?
Well,
Would
Dr.
anyone
Sayyad,
like would anyone would like to add comments at least?
hello,
Yeah. Yes.
Dr. Sayyad, it's the other
Dima.
Dima, the other
The
Dima,
other Dima, yes.
the Dima.
Yeah.
They got back
Maybe I need to ask, sorry, maybe I need to ask like how is not working the over-the-counter medication? Do you need to like use opioid rather than this?
Ah, no, 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 no,
Okay,
no.
sorry.
Yes, other Dima. What would you
yes.
like to add?
Well, I think there's. Can I see the medical profile, please? It's mentioned here that the pharmacist stopped the Celebrex, the celecoxib, because of
Yeah.
reaction.
Yeah, yes,
Okay,
yes.
so I
Fair,
think we
yeah.
should ask here what kind of reaction, why we stopped the celecoxib. If it's like
You should ask about the allergy. She didn't ask about
yes,
allergies?
yes, I
Okay.
think she missed this point.
Yeah,
Uh,
at this point. Yeah.
even though the cross allergy between Celebrex and other NSAID, that Celebrex is like a selective NSAID, so it might not be like severe or a real cross allergy, but we should ask about it.
يا الله نسيتها. I forget it.
Yeah.
I
Yeah.
Yes,
forget.
You should. Yeah, you should ask about allergy. This is very
Yeah,
important. You didn't ask.
yes.
However, there was a note in the file.
yeah.
Mark it here. Stopped by pharmacist because of reaction. Okay. Anyways, for your decision, what would you go here? If you
And
like, let's suppose that you notice that there is like an allergy for Celebrex. What would be your action?
If
well,
there is a true, if there is a true allergy, I can hold the prescription and fax to doctor.
It's like a skin reaction.
Yeah.
So I have to hold and fax doctor to change the medication.
Why, my friend?
no, I would go. I dispense it. I will dispense it and monitor
Why you
the
dispense it? Why would you stop it? I need an
What the
answer.
type of the allergy?
Skin
It's
reaction.
only skin reaction,
Yes.
like
Cutaneous one. Yeah.
spreading in all of his body
Yes,
or
if it's a true allergy, we can't dispense doctor.
Okay.
well, Dr.
Guys,
Tayyab,
let
celecoxib
me
is
let me
selective.
you have the solution with him. You got me? What is the solution here about the over-the-counter medication, correct? What type of medication the patient is taking? He told you that I'm taking Rubax. I assume that you understand what Rubax
yeah,
is.
he already take Ropaxone.
Rubax is ibuprofen plus muscle relaxant, methocarbamol, correct? So
Right.
he's taken already like ibuprofen. This is number one. Number two, he's taken Voltaren gel, correct?
Mhm.
Diclofenac. So
So no problem.
you have an evidence here that the guy is like he's using two other molecule of anti-inflammatory and he didn't suffer anything.
There's no problem.
Okay.
Yes.
So yeah, so this is like it looks like a reassuring thing. So for regarding the dispense or not, no, you can dispense like with a good will, you can dispense without any problems. But at the same time, you have to advise the patient
Watch himself.
to yeah to watch like any sign of allergy because you are still there is still a risk of cross allergy, correct? So this is regarding your conduct here. What you have to do, you can dispense. This is no problem, and just advise him about this. This is number one. Number two, you are totally aware that he's taken like 2 anti-inflammatories over the counter, like, right? He's taken Voltaren and he's taken ibuprofen, and he got a new prescription for naproxen, right?
Yes.
Okay, so what should we do here?
I have to ask him, it is work for you? It seemed not working for him. So why the doctor give him the same medication? Like the same.
Okay.
I will dispense.
Yes.
I can
Okay,
advise him
Uncomfortable.
to stop the over the counter and take only the prescribed one.
Yeah.
Yes, correct. He has to stop. He has to stop the Voltaren and their packs, and take only the Vimovo.
Yeah.
Okay.
Yeah.
Yes, twice daily. That's it.
So I'm
But
good in.
this is the application. This is like therapeutic application here. Okay.
Yeah,
Also,
and one more point. If the OTC medication, the Voltaren and the other one are actually working with him, he wouldn't actually go and see a doctor for another RX.
Yeah.
So they are not working already.
Correct.
So there's no point from keep using them.
Okay. Last point.
stop
What
Dexa.
would be the last concern here?
Some self-care.
We can stop the Dexilin until
Dexlansoprazole.
finishing the Vimovo for
Okay.
14 days.
You stop, or you hold?
Yeah, I hold it for 14 days until we
There's a
finish the
difference.
course.
There's a difference between stop and hold, okay?
Yes, of course.
And what about ranitidine? Dima,
How
the original
they
Dima.
can take two like a gastric medication, GERD medication?
This is possible or not?
He can
I-
take at night
They
if he has
cancel each
recurrent
other.
symptoms.
It is cancel each other.
He can take at night for ranitidine.
Oh, okay, it's at night. Okay, but
There's
one
no
time,
problem.
twice daily.
There's
If-
no problem, guys, from taking H2 blocker with BPI.
Yeah.
There is no problem with that. Some evidence says that like H2 blockers may reduce the effectiveness of the PPIs. Okay, but at the end of the day, they can be used together. Okay, so no problem from mixing them. So you don't have to stop the ranitidine. Okay, you only can hold the Dixilant during the 2 weeks of treatment with the Vmove. Okay, this would be more than enough.
Okay.
Okay, Vimovo should be taken before or after meals?
No, before.
Okay, correct. It's before.
Yeah.
Okay, last point. What would be the last point here?
Self-care or what the same?
No,
Okay.
it's
Okay.
about
For
what about his blood
Yeah,
pressure?
let's keep
blood pressure, yeah.
Yeah. Just
Yeah.
keep monitoring his blood pressure, because that medication can increase blood pressure level, and just keep watch up himself. If any increase in blood pressure, go to your doctor.
Okay, perfect, good. Okay.
It's right in exam we give the hypertensive patient NSAIDs.
We, as a pharmacist, we not give it, but if get the prescription, right, doctor, you are.
Yes, there is no problem. It's not contraindicated. Only
In
precaution to
general,
watch.
yeah, we do
No.
it in real practice, but in exam, I don't know.
Yes, yes,
You,
no, why not?
you can still do it as long as his blood pressure under control and he can like monitor his blood pressure. It's okay. You can just go and dispense it and counsel the patient to keep monitoring his blood pressure and make
Even
sure
he-
it's within normal range.
Yeah, even if he coming for OTC NSAIDs.
I would recommend like any NSAID as an OTC for a hypertensive patient. Usually you
Yeah,
will go with the acetaminophen or Tylenol.
Yeah,
But
okay.
if
At
there is a
OTC, we
prescription,
couldn't. Mm-hmm.
yeah. But if there is a prescription like here, yeah, you
Yeah.
can just go dispense it and counsel patient to keep his eye on his blood
Yeah.
pressure.
Okay,
Especially
got it.
naproxen is the safest NSAID that can be used for hypertensive patient.
Yeah, got it. Okay.
Okay, no problem from dispensing that. Okay, last point, last comment for me on Dima. Dima, you spent about like 2 minutes reading the profile.
Yeah.
Okay, which took you so long. Honestly,
Yeah,
I'm like,
when I
go
see
back
the
to your.
profile, I'm scared. It's too much drugs.
You don't have to go like that with the way you go. You went. You got me. So what you can do with that, I just tell the patient that I see that you are taking medication for your bone, and you're taking some for your stomach and for cholesterol, blood pressure. Are you still taking all the medication as as it were prescribed? She told you yes. And from the file, I can see that you used to have like Celebrex a prescription and it's inactive now. What is the reason for that? She will tell you like I had a reaction or something.
Okay.
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 So you don't have like to go one by one. You have like 10 medications. If you go one by one and you're already taking that once daily, are you taking that twice daily, etc. You got me? So it's
Yeah, I got it.
you will
Okay.
not finish.
Thank you very much.
Okay.
Thank you. Thank you.
Okay, that's it. Just if you have so many medications, go by like indication. You're taking some of the medication, about 2 or 3 medication for blood pressure. You take them as prescribed. Yes. Do you have any questions? No. That's it.
Yeah. Thank
Okay.
you. Thank you very much. I got it.
Go fast like that, but spending 2 minutes and reading only the profile is like a waste of time.
Okay.
Okay, good. Okay, so our concerns were about like the duplication, therapeutic duplication here, the muscle relaxant, the anti-inflammatory with the over-the-counter medication that he's already using. This is number one. Number two, no concerns, no fears from the allergy. So for Celebrex, with the patient is already taken anti-inflammatory, two other types of anti-inflammatory, 2 other molecules of anti-inflammatory, the diclofenac and the ibuprofen. So dispensing naproxen wouldn't constitute any problem. Last thing with the blood pressure, the comorbidity the patient has with the blood pressure. So it would be wise to watch a blood pressure during the treatment of this. Last one is holding the Dixlant. I mentioned that already. The duplication, yeah. It comes under the therapeutic duplication. So Dixlant should be held for 2 weeks. Okay. Any questions? A straightforward case. Straightforward case. It's only like it required only that you be focused, you be efficient in assessing the case.
Time management.
Giving your recommendation, yes.
I have one question, sir, please.
Go ahead.
So we are for the cover Sil Plus and the amlodipine, we are just giving together and saying to monitor his blood pressure more frequently.
Yes. Blood
Okay.
pressure with naproxen, yes.
Okay, thank you.
Okay. If you would like to add something, you can add that keep well hydrated. But the patient is taken like ACE inhibitors. ACE inhibitors with the NSAIDs, it could increase the risk of
Dehydration.
not dehydration,
Kidney injury.
yeah, the renal toxicity, kidney injury.
Okay. Thank
So
you.
yeah, just keep well hydration. It's like a precaution.
Okay.
Okay, recommendation. Okay, perfect.
Usually in the pharmacy, I'm sorry to interrupt you, Dr. Mohammed. Usually in the pharmacy, when I'm really concerned about the blood pressure, I usually tell the patient to keep your eye on your blood pressure, and you need to monitor also if there's any change in your urine output. Because usually like the first thing
Yes.
that can be affected by high blood pressure is the kidney. Especially in this case, the patient is taking ACE inhibitor, which can cause kidney injury by itself, and also naproxen now. And he was on ibuprofen before. So if you want to go more, if you have more time, you can just add you can watch out your urine output and make sure it's normal. But if you want to just say keep your eye on your blood pressure and make sure it's within normal range, that's enough.
Yes. Okay, yes, this is important. Station 2.
Yes, can I do it?
Can I do it?
يلا يا باشا بنت بلاد.
Okay.
عندي
Station
سؤال
3.
بس، هو انت حضرتك متأكد ان ده ستريت فورورد؟
هو ده مش ستريت فورورد يا جماعة ولا إيه؟ انتوا هتهزروا؟
اللي هو البروفايل بس كان أدوية كتير قوي في واحد يعني
ده
مش
ما فيش،
عارفة ايه.
ده نقنقة، كلها حاجات نقنقة في
حاجات بسيطة.
بتيجي ساعات يا دكتورة كده فعلا، بيجي تلاقي فيه فايل كبير كده قدامك،
تمام.
وفي أدوية فعلا ساعات بتبقى كتيرة يعني، بتحصل يعني.
طب ازاي امانج الفايل اللي هو المفروض فيه كذا دواء دكتور احمد بطريقه سريعه، يعني ان انا
زي ما
مش
الدكتور
وقت.
محمد قال لحضرتك كده ايه،
مم.
انت بس بتعدي على الادويه ديت، انا شايف ان في دواء في دوايين، دواء للضغط، وفي دواء مش عارف ليه، ودواء ايه، دواء ايه، دواء ليه، هل الادويه دي كلها بتاخدها زي ما الدكتور كاتب؟
مم.
في اي سايد افكت سو فار؟ لا. في اي كومبلين؟ لا. خلاص تمام، انتهى كده. تمام.
اوكي.
لو في
Your
حاجه
your
في الفايل
concern
او
your concern هبة your concern was about the over the counter medication. If you ask a
تمام.
proper
مم.
question about the over the counter medication and you understood that the patient's taken other NSAIDs plus
مهم.
multi relaxant, the station is solved.
اوكي.
Okay.
بالظبط.
Excellent.
هو
It
usual
can easily be spotted. The excellent is
بالظبط. هو بيبقى
easily.
يوجوالي يا دكتور محمد، يوجوالي بيبقى فيه 1 or 2 تريكس في الستيشن، ما بيزودوش عن كده، عشان هم
Yes.
عارفين ان الوقت مش هيسعفك انك انت تغطي كل حاجه،
Too much.
فيوجوالي هي بتكون 1 or 2 تريكس ماكسيموم، ما
اوكي.
بيزيدش عن كده ابدا يعني.
Yes.
تمام.
Correct. Okay. بنت بلادي الكيسة الجاية.
Okay, and I'll share the reference.
Okay. Share the reference.
And who is going to do the next?
It's yeah, Heba gonna do it, and afterwards, who's next? Uzma,
Yep.
and who's next, guys? Please raise your hand. Keep your hand raised.
Oh,
Who's else? Okay, we have Farial, Amber, Uzma. Perfect.
Okay, PharmaFree.
Did you share the? Yeah.
Yeah, and just one more minute.
Station 10. سهلة دي. توصب قريبتنا يا عم.
Okay.
Okay,
just give me one more minute, doctor. Sorry.
no problem.
بس بحاول أسهل دكتورة هبة الدنيا.
يا باشا يعني لا يعني ادينا اصعب حاجه، عايزين يعني تعلى بسقف
Okay.
توقعاتك.
ماشي. اوكي خلاص.
هنبهرك يعني، ربنا يستر.
لا ان
داخلة
شاء الله
الأسبوع الجاي؟
ايه يا دكتور؟
داخلة هيبقى الأسبوع الجاي؟
باذن ربنا ان شاء الله، ربنا يسترها.
يور فاس ان شاء الله.
يا رب.
Okay, and share.
Let's go my friend. لسه نظام؟
بس هي الفايل بيتبعت بس.
اتبعت already. ده
دي ريفرنس ولا ريفرنس واحد؟
one or
إيه ده؟
two.
Yeah. 2 references.
Yeah. Different.
All right. Okay, I'm ready.
Let's go, yeah. I'm gonna start. Heba, you have 30 seconds if you'd like to go through the
اوكي ماشي.
references. Yeah, go ahead.
ماشي انا جاهزه.
Okay, here we go. So let's start.
هل هو
Start
I am here
study.
at the pharmacist؟ اوكي ماشي.
Go ahead.
Hello, I am Hiba, the pharmacist. How can I help you today?
Yeah, hi, my name is Dr. Nezam. I'd like to prescribe this prescription for malaria prophylaxis for a patient. Her name is Hillary Clinton. Uh, it's mifloquine 250 milligram tablet, and I would like to know if this is the best option for her or not.
Sure, doctor, I can help you for that. Can you please have a seat to discuss further about patient condition? Just I need to
Thank you.
confirm a patient name and age, Hillary Clinton, and she is 38 years old, right?
You're right, yes.
Okay, doctor. Is she pregnant or breastfeeding?
No, she's not.
She is not. Okay. Her weight is 65 kg. And
You're right.
you need to write mifloquine 250 milligram for her as malaria prevention.
Yeah, 1 tablet once weekly and 8 tablets for total quantity.
Oh, okay. Okay, doctor. Does she has any medical condition?
Yeah, I think you have the patient profile in your pharmacy in front of you.
Okay, yeah, let's see, let's check her profile here. I see that she take risperidone. For what reason, doctor?
I believe psychosis.
Okay, and also she take erbeprazole. Still take it?
Yes.
Okay. Can I know for what reason?
Yeah, for anxiety and low mood.
Okay, doctor. Lorazepam 1 milligram once daily at bedtime as needed. I think
Yes.
this is from Dr. Johnson.
Yeah.
And she take also Bentaloc from Dr. Johnson. So, doctor, I just need to confirm, are you aware that she takes this medication from another doctor?
I am. Yes.
Okay, perfect. And also she take calcium 500 milligram. Okay.
Mm-hmm.
Do you have any idea about his lifestyle, doctor?
No, I'm sorry.
Okay. What about renal and liver function?
Both are fine?
Is normal?
Yes, they are.
Okay. She will travel to area with malaria infection, right?
Yes.
Can I know when she will travel?
She's traveling in 4 days.
4 days. And how long she will stay?
She mentioned like 1 month.
1 month. Okay, doctor. So you come today to ask about mifloquine for her condition as malaria prevention. Do you have any other concern?
No, thank you.
Okay, just give me a second, check my reference and back to you.
Sure, take your time.
Okay, doctor, thanks for waiting. Thank you for waiting. Actually, since our patient has a psychiatric disorder, we can't give her mifloquine because it's not recommended in her condition.
Okay.
Okay, doctor. So we have two options. We can give her atuvacum preguanil, or we can give her primaquine. So which one you prefer, doctor?
Whatever you recommend.
Okay, so I recommend to give her atovaquone briguanil. She will take 250
2
milligram.
minutes.
Okay, she will take 1 to 2 days period to travel, and she will continue daily while she is in malaria region, and after that she complete 1 week after she back from her travel.
Okay.
Okay, doctor. So I will. Can I call patient? Is it okay to make an order for patient and give her some advice about before she travels to this endemic area?
Yeah, sure.
Okay.
Okay. Yeah, sure.
Yeah, it's better to update her vaccine before travel and to follow some instructions to prevent malaria infection. I will call her to update all this information and advise her to see travel clinic before she travel. Okay.
All right. Okay.
Okay. Do you have any other question, doctor?
No, thank you.
Okay. Thank you.
Okay. ست دقايق الله ينور. قول يا نظام.
Okay. Excellent. Okay, but I have to, or let's say one. Okay, you didn't ask like where she's traveling to.
Yeah.
And
It's
this is an
it's one of the
important question.
Yeah.
Yeah,
I
because
asked
you know,
about.
like, yeah, go ahead.
No, تفضل. No, تفضل.
Because you know there are some like chloroquine resistant area, doxycycline resistant area, whatever, or even like the species of the malaria itself. It may like vary between one area to another. So you need to know where the patient is traveling to give the best recommendation.
Okay.
You focus on like the medical condition, which is psychosis, and this medication is contraindicated in psychosis. So we need to give something else. This is excellent. Okay, and all your questions are relevant and very really good. But just try to ask also the most important questions in this case. This case is always about the medical conditions, the place the patient is traveling to, and when is he traveling, as you asked. I would actually tell the doctor mefloquine is not the best options because of two main reasons. One of them is the medical condition. And the other reason is that the patient is traveling actually in 4 days. And this medication, according to the reference, has to be taken few weeks before traveling.
Okay.
So you need to mention both points, just to let the assessor know that you actually read the reference and know why this is not gonna work. Then the two main options remaining will be doxycycline or atovaquone. If you go with atovaquone, tell the doctor I will go with this one because the patient is traveling to this area and there's like a resistance in this area, and this would be the best option in terms of his medical condition and also the resistant rate in this area. Plus, it can be used 1 or 2 days before traveling. So it will be the best option regarding all such, terms or such points. Doxycycline is another option. You can give me both options, okay, as you mentioned, but you should give me some like information. Doxycycline is good option, but the patient is taking calcium. There may be like some interaction between doxycycline and this medication, and also his own pantoloc, and doxycycline may increase the risk of acid reflux and stomach problem. So I would actually stick to the proguanil and atovaquone.
اوكي يا
واضحه دكتوره معاكي؟
كنت متوتره فاللي هو مش يعني
طب بصي، هي الكيسه دي يعني انا شايف انها ممكن انت تاخدي عليها فولي سولفد. انت قلتي ليه مش هتستعمل الدواء اللي هو الدكتور كاتبه، واديتي ريكومنديشن وازاي يتكتب وازاي يستعمل. لكن ممكن بعض الناس يديك عليها partially solved على اساس انك انت يعني ما وضحتيش برضو انت ليه رحتي للاتوفاكون بروجوانيل وما رحتيش مثلا لحاجات تانية. ما رحتيش ليه مثلا للهيدروكسيكلوروكوين.
يعني لازم اكمل بقى الصوره، يعني انا اخترت الدواء فاقول له
بالظبط.
بقى انا ده
اصلا انت
الراشونال بتاعي.
بالظبط you still have like 4 options. عندك hydroxychloroquine, doxycycline, اتوفاكون، بروجوانيل، مش عارف كان في واحد كمان مش فاكر اسمه ايه
بريماكين.
بالظبط. why this one why this one? Why did you go with this one? Why not hydroxychloroquine? Why not doxycycline? Okay, so yeah, give rationale behind your answer just to support your answer. For me, I would say I would actually avoid doxycycline. Can be used, it's a good option even if there's like a resistant, still is a good option and can be used 1 or 2 days before traveling, but I would actually stay away from this one because patient has history of peptic ulcer or acid reflux, and doxycycline, as you know, is very hard on stomach. Plus, he's taking calcium, which may interact with doxycycline and decrease its absorption. زي ما انت عارفه العيله بتاعت التتراسايكلينز كلها
ايوه تمام.
فيها مشكله مع الديري برودكت والكالسيوم والمغنيسيوم. اوكي so I would actually and I would avoid hydroxychloroquine. لو انت بقى كنت سالته هو مسافر فين، تمام، كنت هتلاقي الاريا اللي هو مسافر ليها فيها resistant high hydroxychloroquine or whatever chloroquine resistant area, something like this. So I would actually go with the atovaquone proguanil. It should be the best option because it will avoid all of these problems.
هو انا استبعدت الكلوروكين علشان برضو هو سايكوزيس، فانا اللي فاكراه ان هو ما بيتاخدش في مع الامراض اللي هي السايكاتريك وكده.
اوكي قولي البوينت دي يا دكتور، لان انت عندك 4 اوبشنز موجودين للعلاج غير اللي الدكتور قالهم. قولي انت ليه هتستبعدي الهيدروكسيكلوروكوين، ليه هتستبعدي الدوكساسايكلين، ليه هتستبعدي ده، ليه شايف ان ده افضل حل عشان الدكتور يقتنع ويكتب.
اوكي تمام يا دكتور، شكرا. تمام.
But anyway fully solved or partially solved يعني in my opinion. معرفش دكتور محمد لو عنده تعليق ولا حاجة.
Yeah, for me it's like fully solved honestly. She
Okay.
did what she has to done, but you know it's asking for destination is very important as well.
Yeah.
Okay, this is a main question that you cannot be missed. So this is very important. Otherwise, I think you did the right. Yeah, you did what's right. Yeah,
Okay.
it's like this one is like straightforward.
Yeah, it's a very straightforward case.
Very straightforward case. Okay.
Yeah, sure.
Perfect. So
But it's a very important case, by the way. Very, 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 very important.
yeah, important. Yeah, malaria prevention is one of the main scopes of the pharmacy, of the pharmacists here in Canada. So yeah, this is very important.
Okay.
Nice. Well done, guys. It seems like that you are very well prepared.
Well prepared. Yeah, they are.
Okay, so let's move forward. Uzma, it's been like a while that you are raising your hand. So
yeah. Okay.
yeah, let's take Uzma. Afterwards, we'll
sorry, Dr. Mohamed, may I ask a question, please?
Yes.
About the illustration, should we like recommend like to call the patient and tell him?
Sorry. Hello, Dima. Hello, Dima. حد سمع ديما؟
لا فصل.
Okay, Dima, we cannot hear you. Okay, Uzma, let's move to station number 2. Yeah, there is no reference here.
Sorry, Dr. Ahmed, are you
Yeah,
hearing me
go
now?
ahead. Go ahead.
Okay,
Yeah.
sorry, I have problem with my mic. So I was asking, can we say that we are going to call the patient to tell him a little bit about non-pharm measures to prevent malaria?
Yeah, Dr. Heba, she did. Yeah.
She did already.
Yeah,
Okay.
she did tell that. Yeah.
Okay, and one more question, a general one. During the OSCE exam, they will provide us with reference like you do, like some pages only, or the whole book, or
Usually some pages, usually like 2 or 3 pages.
Yes.
Okay, okay.
Yeah.
Okay. Okay, thank you.
I was actually trying to give Dr. Heba only 2 or 3 pages from CDC. where the region is, but she asked for the entire reference and she didn't even read it.
Okay, okay. I mean, like if we have the reference, it will like guide us through the station, what to focus on, what to search for. Okay.
Yeah, I
Okay.
remember it was just like 2 pages or 3 pages maximum.
Okay, great. Okay, thank you.
Okay, station number 3.
Yeah. I have
Okay,
the time.
yeah. Can you watch the time, Nezam?
Yeah.
Uzma, can you hear me?
Yeah. No reference?
No, there's no reference.
Okay.
Okay, sounds good. So let's
Yeah,
get
yeah.
Nizam, please kick in the time.
Okay.
There you
Okay, go ahead.
Hi.
Hi, my name is Usma. I'm the pharmacist on duty today. How may I help you?
Yeah, my name is Donald Trump. I'm a patient here. I have a file here. So I would like to increase my dose of Vivance to 30 milligrams. So it's been like 2 weeks now, or more than 2 weeks, that I'm using 20 milligrams. So I think for the prescription sent from my doctor, I supposed to have the 30 milligrams. Yeah. You
Okay,
have
sure. I can help
you
you
have
with
that
that.
prescription. Yeah, the original prescription is scanned in my file.
Okay.
Okay.
Okay, Donald, I can help you with that. First of all, is it okay? I will ask you a couple of questions before dispensing the medication to you.
Yeah, sure.
Yeah, so your full name is Donald Trump and you're 21 years old. Is that correct?
Yes,
And you said that you want to increase the dose to 30 milligrams, right?
correct.
Yes, but I can see your profile, your prescription here. The prescription for the Vyvanse is 10 milligram for 7 days, then increase to 20 milligrams for 7 days, and then stay on it, uh, or or increase to 30 milligrams if well tolerated. So are you taking this? You are taking the 20 milligrams right now,
Yes, I'm taking the 20 milligrams. I spent it
and
once for I dispensed it once for 1 week. Then I
okay.
decided to remain on it.
Mm-hmm.
Next, like the next last refill was for 30 tablets, and
Okay.
it's like 2 weeks now that I'm using them, but
Mm-hmm.
they are not so much effective. I would like to increase to 30 because I have exams. I'm a little bit nervous about the exam.
Okay, sure. Okay, I will try to help you out. So we last filled 20 milligrams, 30 capsules 14 days ago. Is that correct?
Yeah,
Yes. So you still have the remaining supplies for the 20 milligrams for the 16 days, right?
correct.
Yeah, so it looks like you are 16 days early for this medication.
Yes, correct.
Yes. Okay. So besides Vyvanse, are you taking any other prescription medications from any other pharmacy
No, I'm not. No, I'm
or
not.
any over-the-counter medications?
Uh, I would like to take a sleep pills as well because I'm not sleeping so well.
Okay, and which
About my
sleeping pills you
counter.
are taking? Sorry.
I would like to ask you for that.
Oh, you want to ask me for the sleeping pills, right?
Yeah.
Okay. And are you allergic to any medications?
No,
No allergies. Okay. So a few questions about your lifestyle. Do you drink alcohol?
no,
What about your diet?
it's normal one.
Okay. And do you drink coffee?
Yeah, sometimes.
Okay. Okay. So just give me a moment. I will collect my thoughts and get back to you. Is that okay with you?
Yeah, sure. Take your time.
Can I see the prescription? And the profile? Okay, thank you for patiently waiting, Donald. According to the prescription, that actually the doctor put the interval on the prescription, which is the
2
30
minutes.
tablets every 30 days. Okay. The doctor also write that first spend 7, and the doctor also write that you can increase the dose to the 30 milligrams. Well, I can fill the 30 capsule, but I can fill the 30 capsule in the next 16 days. How does it sounds to you?
What do you mean?
I
16
cannot.
days?
Yeah, I can fill your prescription, but I can fill your prescription because it is early. I can fill it in the next 16 days because you have, I can dispense the medication after the 30-day interval.
Okay, but I have the right to get the 30 milligram tablets as well.
Yes, but the doctor put the interval as well, that 30 tablets every 30 days.
So what should I do?
Okay, can I see the prescription now?
Yeah.
Okay, so as you want to increase the dose, okay? And you are feeling any side effects from the previous medication, any bothersome symptoms?
No, it's okay.
Okay. I can increase the dose as you already take the first 7 days pills, right?
I'm taking what? Sorry?
You take the 7 days of the 20 milligrams, right?
I told you that already.
Yes. So I can dispense the 30 tablets of the Vyvanse to you, okay? But you said that you have a remaining 16 tablets in your at your home, okay?
Okay.
Okay. So
Time.
Time?
Yeah.
oh, I'm so confused.
Okay, no problem.
Yeah,
It's
we
like
cannot double this one because if it's double, then it becomes 40. The patient cannot take the 2 tablets, 2 capsules.
it's like what do you think?
Can I say something?
Right.
Yeah, go ahead.
Vyvanse is back order. It's unavailable.
Yeah. Yeah.
So
can-
it's the equivalent dose will be Concerta 36 milligram is available, but I have to fax to doctor first.
Oh, I cannot see this one. Vyvanse 30 is the back order, but
Okay,
he
guys,
has
well,
let's have it like in a frame. Let's go with somebody else to retake this station.
We are ready, sir.
Yes,
Okay, who can do it, guys?
yes, I can take.
Thank you, Uzma. I will get back to you.
okay.
Who is it? Amber?
Yes.
Okay, Amber,
Okay.
let's go. Let's start.
Go ahead.
Yeah, run the time, please, Nezam. Yeah, here
Yeah.
we go.
Yeah, go ahead.
Yeah, my name is Donald Trump, and I would like to have Vyvanse 30 milligrams, please. My
I'm
prescription.
sure I would help you with that. Yeah, sure, I would help you with that. Please have a seat in our private counseling area. And all information I collect will be kept confidential. I'm a B.Pharm pharmacist. Okay, so Donald, I received a prescription regarding Vyvanse, and your doctor has said to take 10 milligram for 7 days, then increase to 20 milligram for 7 days, then stay with it or increase to 30 milligram if well tolerated. How you are, so you have taken 10 milligram for 7 days.
Yes,
And
I dispense it twice. One for 7 milligrams Okay, and second dispense was about 30 milligrams because I decided to stay on 20 milligrams. But yeah, at the end, I found out that that's not like a correct dose. I'm still like a little bit confused. I'm not so much able to concentrate, and I have exams. It's like I would like to increase. I would like to go up to 30 milligrams.
Okay, okay, Donald. So I can understand that you are having insufficient response from 20 milligram. So as your doctor has also authorized you to increase to 30 milligram according to the prescription directions. So do you have, before I proceed, do you have any other medical conditions?
No,
Are you allergic to any medication?
no,
Any prescription medications other than I can see on the profile?
no.
Any over-the-counter medications like a bus vitamin supplements, any samples from the doctor?
No, I would like to ask you for sleeping
Okay.
pills.
Yes, yes. Thank you so much for waiting patiently. So, as your doctor has granted you the permission to take 30 milligram, depending on your response, and you are having insufficient response from 20 milligram because your symptoms are not sufficiently controlled. So, I would give you 30 milligram Vivance capsule. But the problem is that Vivance 30 milligram is back order in our pharmacy. And so, I can give you the equivalent dose of Concerta, which is equivalent to methylphenidate 36 milligram. Is that okay with you?
To the other medication, you mean?
Yeah, 30 milligram, and 30
Concerta?
milligram Vivance is not available, so I will give you Concerta 36 milligram methylphenidate.
Okay, but I have already used Concerta in the past.
Okay, so what was the response and why did you stop there?
Not so much. I went up for 54 milligrams, but it didn't work. That's why my doctor decided to switch to Vivance.
Okay, so you were not tolerating 54 milligram of Concerta, right?
Yeah,
I
I
think.
reached to yeah,
Okay.
I went up
Okay.
to 54 milligrams.
Okay, that was the for 54 milligram, but the 36 milligram would be sufficient and it is equivalent to the 30 milligram of Vyvanse. So you will not experience.
I tried the 54 milligrams, but it wasn't enough. And you're telling me that 36 milligram will be sufficient?
Oh, 54 milligram was not enough. Means how, like, what about your symptoms and what about your activity and concentration with the 54 milligram?
I told you it wasn't like it
Was
wasn't
not,
so much effective.
it was ineffective, right?
Ineffective, yeah.
Okay. 54 milligram was
That's why we switched it. Yeah, that's why we switched it to the Vivance.
Okay. Okay. So can I see the profile, please?
Yeah, sure.
The prescription. Yeah.
There you go.
So I would thank you for waiting patiently. I would contact your doctor regarding. I will fax your doctor and would.
For what? Fax him for what?
Yeah, so I have problem over here because in the drug monograph I remember. Sorry, I'm breaking it over here. Because in the drug
The
monograph,
problem.
I have given
Why you didn't give me the 30 milligrams?
because you are having like 54 milligram was ineffective. I can give you 2 tablets of 36 milligram.
I don't have what I have a prescription for Vivance 30 milligrams. Can you please give me 30 milligrams tablets of Vivance? I don't
30,
understand that's the
30
problem.
milligram is back order. I can give you 36 milligram. You use it and then see your response.
2 minutes.
Okay, you're gonna give me Concerta 36 milligrams,
Yes.
and if it's not effective, I can go up to 2 tablets.
Yes.
I can take 2 tablets. Okay, sounds good. This is good. Yeah, this looks good for me. And what
Okay.
about the sleeping pills? Are you gonna give me anything?
No,
You had
I'm not going to give you the sleeping pills. You can change the timings of methylphenidate and shift it to the morning.
did I told did I tell you that I take it anytime?
Okay, at what time do you take it? Don't take it before 4 p.m.
I'm taking it noon time.
Okay, you are taking it at noon time.
Yeah.
And you are still experiencing sleeping problems. Okay, so I would like suggest you to take it a bit earlier, like in the morning time. And I
Right.
would also suggest you good sleep hygiene for that, like use the room only for sleep and intimacy. Keep all the noise and light emitting devices away from the room and avoid daytime napping.
Okay, sounds good.
Okay, avoid exercise within 2 hours of sleep and caffeine and alcohol within 4 to 6 hours of sleep. Would you have any
Okay.
questions for me?
No, all is good. Thank you. You're gonna dispense me now the concerto?
Yeah, 36 milligram, and it, depending on your response, I can fax your doctor to increase it to 2 tablets.
Thank you so much.
Okay, thank you.
Bye. Okay.
Because this, yeah, you didn't give any, sorry, sir, you didn't give any monograph, but they
Yes, yeah, I don't know what's the problem in this station.
6 minutes,
Before
50.
the starting the session, I told Nizam this is like the easiest station. This is the easiest. It's supposed to be the easiest one. Okay, I don't know what's the problem. Guys, what's the problem here? How should we solve this?
You should give him 1 tablet 20 milligram and 1 tablet from 10 milligram.
Yeah.
That's it.
Yeah,
That's it.
that's it.
Life is
Yeah,
easy.
that's what I'm thinking too.
Life is easy, guys. What
Mhm.
are you doing now? How do you dispense Concerta 36 milligrams, whereas the patient told you that I used 54 milligrams and it wasn't effective?
And Concentra long
I am
acting.
not wrong, sir. I remember in the drug
clearly,
monograph of Ritalin, there is a table, conversion table with between
I
methylphenidate.
don't care about conversion table, my friend. I told you that I was using Concerta at 54 milligrams just before I switched to B.Pharms, and it wasn't effective. And you decided to dispense the medication at lower dose and even advise the patient to double the dose. If it's not effective, he can double the dose. This is not like a proper conduct, honestly speaking. It's like, okay.
Wait, doctor, but can we break the interval?
Sorry?
Can we break
Yeah,
the interval from the doctor?
What do you mean, sorry?
Can we
what
break the
about the
interval? The
interval?
doctor already said only 30 tablets every 30 days. So he already have like Vyvanse 20 milligram for so I will give him another, like if he has still 16 tablets, I will give him from the 10 milligram another 16, but I
Yeah.
don't have any I mean the rules for controlled medication, so I can't
What's
give
the rules,
him,
guys?
I can't
It's
break the
clear.
interval, right?
You dispense 30 capsules every 30 days. 30 capsules here
Okay.
means 30 dose. So, because it's what? You have you have three strengths in the prescription, correct? You have 10,
Yeah.
you have 20, and you have 30. The patient has the option. He's like the one who decides which dose he would like to take. Either 20 milligrams, he can take it for 7 days as a trial, and then he can decide to stay on it or to increase to 30 milligrams. That's it. So what's the problem? What's confusing here? He can decide to stay on 20 or to go to increase to 30 milligrams. The patient is not feeling so well with 20 milligram, and he would like to make use of his privilege and increase the dose of 30 milligrams. Okay, you don't have the 30 milligram in stock, so to manage this situation, you will dispense the remaining for the remaining interval, the 16 days. You will dispense 10 milligrams to complete the prescribed dose of 20 milligrams. Okay, you are not breaking any rules here. Okay, you are correcting, you are like behaving according to the situation. You got me?
Yeah, thank you so much.
Yep,
Okay,
yep.
so it's clear. 30 capsules means 30 dose. You can give 20 or 30 milligrams. And you have a situation out of control. The 30 milligrams is back order.
But
Okay.
doctor, he
If the
determined
30 milligram would be available, if 30 milligram would be available, you can simply tell the patient, okay, so please bring us back the 60 tablets that you still have at home, so we can destroy them properly, okay? And at that time, we can dispense you with the 30 milligrams. Okay, that's it. So you can, to be more secure, you can, if the 30 milligrams will be available, but you don't have 30 milligrams and they are not available in the market. So the only option that you have is to go to complete the dose with the 10 milligrams, not to give him like an equivalent dose of Concerta or any other thing. Do not complicate the thing. There's, yeah, one of, yeah, I think it's Ozma.
Yep.
He told the patient to come back in 16 days so we can give him the right dose. This is as well not a correct, not like a correct conduct. You understand me, guys? So the
Yes,
situation is
doctor.
clear, and you have the information, you have you have like the reference to give him the right dose, the 30 milligrams.
Mhm.
Okay, so
Okay,
don't
okay, doctor, the doctor specify 10 milligram for 7 days. So it should be not more than 7 days, 10 milligram. Then he can choose between 20 and 30, but not 10.
No,
I can understand like this, the prescription.
No, this is like a very, what we call this, very orthodox way of understanding the things. It's not like that. Okay, you should have your own judgment and your own professional sense. 10 milligrams, he prescribed that for start like titration, the titration of the dose. We start at 10, 20, 30, 40, 50, etc. Okay, he wrote 10 milligrams. It means do not dispense ever 10 milligrams to this patient for 7 days. Okay, what if the 30 milligrams is not available, for example? So you will give 20 plus 10 milligrams. And this is like, it happens a lot it happens frequently in the practice, guys. You will find this situation. If you don't have 30 milligrams, you give 10 plus 20 milligrams. What is the problem here? Okay, it's about the dose. What dose is it? It's not like what capsule should I give to this patient? Should I give him only 10 milligram capsule or 20 milligram capsule? It's not like that. Okay. So as I mentioned, as long as your decision is rationalized according to the context of the situation, context of the station, so don't worry about any conduct. Do not be like so hesitant. Okay.
So, doctor, here we counsel the patient to take the rebounds in the morning, early in the morning, so he will like benefit from full effect of it, and the insomnia will be resolved by itself.
The action for insomnia is about the timing of the medication.
Okay.
He's taking the medication at noon.
So the best option here is to tell him to take it as early as possible.
Yes, take it in the morning, in the early morning, and try that for about few days. And if it's not like your insomnia is not resolved, you can call us, you can come back,
Okay.
and then we can give you like over-the-counter medication for a few days and try. That's it. If not, so this time you have to go to see your family doctor, and that's
Okay, thank you.
okay. Station is clear. Correct? It's a little bit confusing, but I don't know why. It's like very, very straightforward station, honestly. That you
Yeah, I
get
think
panic.
Dr. Mohammed, the most confusing part for like for Dr. Dima is that the 10 milligram prescription is already inactive. It's not, it doesn't exist anymore. And she said, okay, the patient is now completed the
but
10
because
milligram.
he took it.
We can't get him back to the 10 milligram. Am I right, Dr. Dima? I think that's what she meant.
You mean other
I think-
day, not me.
I think no, I think Feryal mentioned this point.
Yeah.
Real? Okay, sorry. Okay, all right. Yeah.
Yes, that's what I mean.
Yeah.
Okay.
Yeah, I think as Dr. Mohamed mentioned, we are not breaking any rule. Patient has fulfilled like the conditions or the terms set up by the doctor. He completed the start dose, the 10 milligram, and then he completed the second step, which is the 20 milligram for 7 days. And after 7 days, he has the right to stay on the 20 milligram or to increase to the 30 milligram. We dispensed for him like 1 month supply of the 20 milligram, but after like 2 weeks of using 20 milligram, he's not feeling well, and he has the right to go to the 30 milligram. This
Yes.
is the point. He still has the right. Yes, we give him like 1 month supply of 20 milligram, but he still has the right to go up to 30 milligram at any time during this month. So simply, he still have like 16 tablets left from the 20 milligram. So either he returns them back to the pharmacy, and we give him the rest of the month, which is like 14 days of 30 milligram if they are available, or give him like only 14 days from the 10 milligram to be used along with the 20 milligrams to get the 30 milligram dose. Is it clear now? I hope it's clear now.
Yes, it is. Thank you.
All right.
Okay.
So
Perfect.
last station.
Station 4. Let's go. Station number 4. It's Feryal, I think.
Yes.
Okay, I'll share the reference.
Yeah.
Okay. Where's the reference? Oh, here. Right. Okay.
Okay.
Please, Dr. Faria, read the.
We're gonna give you 30 seconds. 30 seconds,
Yeah.
okay?
Okay, just want to get the reference.
Yeah, 30 seconds. Here you go.
You can use your extended scope of practice in this case.
Okay, just I want
It's a
to
hint.
open the
Okay.
I want to open the reference here. Okay. Okay.
Did you hear me, Dr. Faria?
Yes, now I can I read the door note? There's a door note?
No, there's no
Yeah.
door note, but you can
Okay.
use your
Here
extended
profile.
scope.
Yeah, only profile.
Yes.
Yeah.
Okay, we're gonna start.
You can use your extended scope of practice in this case.
Yeah.
Okay.
Yeah. Okay. Okay.
Start, please.
Okay.
Go ahead.
Go ahead.
Okay. Start.
Yes.
Yeah. Go ahead.
Yeah. Hi, I'm Feryal, the pharmacist. How may I help you?
Yeah, I'm here to pick up my new medication, please.
Yeah, sure, I can help you for that. Please have a seat in private counseling area. Whatever we discuss will be kept confidential. Can I confirm your name and age?
Yeah, my name is Jana Smith, and I'm 70 years old.
30?
70.
70. Okay, 70. Okay, Jonah, what made you see the doctor today?
I was actually in the hospital, and I was just like discharged this morning, and the doctor wrote a new prescription for me. I think it's for potassium because my potassium is low and it affected my heart somehow.
Okay, it's most concerning and hard for you, Jenna. I will try to help you. So, where the prescription? Is there any prescription?
Yeah, where is the prescription?
Where is the prescription?
You found it?
No. What is the prescription?
Oh, yes. Where is the prescription?
Yeah, good question. What is the prescription? Yeah.
Okay,
No,
solved.
it is.
Fully
Yeah,
solved.
here it is. Sorry.
Okay.
Here you go.
Okay. Thank you. So the doctor prescribed for you potassium chloride, the 20 milliequivalent tablets. Okay.
Yeah.
Okay. Can I ask a few questions to check the appropriateness of this medication?
Sure.
Okay. So what's your medical condition?
You have my file.
What?
I have a lot
Okay.
of medical conditions. You have my
Yeah,
file
I
in
can.
front
Can
of
I
you.
see the profile? I didn't see anything. The profile.
Yeah.
Okay. And yeah. First of all, do you have any allergies?
No, I don't.
Okay. And the medical condition you are taking amitriptyline for which indication?
Mainly for nerve pain
Yeah.
and depression.
Okay. Yeah, I got it. Ramipril and metoprolol you are taking for blood pressure?
Actually, for my heart. Yeah.
Okay. You have heart myocardial infarction. What do you have?
I don't know what is myocardial infarction. I had like heart attack a
Heart
few
attack.
years
Okay.
ago. Yeah.
Yeah. Okay. It must have for you. And everything is so far good with this medication, control your condition?
Yeah, I'm using them according to
Yeah.
doctor
Okay, good.
instructions.
Yeah. And atorvastatin and hydrochlorothiazide for the same indication for the heart attack, right? For protection, right? And
I don't know. It's for my heart. Yeah.
yeah. Okay. I still take all of them, right?
You're right. Yes.
And metformin and what is that? I couldn't see it. dapagliflozin.
Yes.
Yeah, you for diabetes, right?
You're right.
What the last reading of A1C?
I don't remember, but the doctor is happy with my readings.
Yeah, it's good, and also the blood pressure reading is good.
Yep, they are.
That's great. And aspirin for cardioprotection.
Yes.
And pantoprazole for which indication?
For acid reflux?
Yeah, okay. It's you still take it, right?
Yeah, I'm still taking it. Yeah, because I
Okay.
had ulcer before, and the doctor asked me to keep using this one.
Yeah, okay, good. Beside these medical conditions, do you have any other medical conditions?
No, just like my potassium level, the doctor mentioned it's low, and I need to start using the new prescription.
Sure. Do you have any other medication from other pharmacy?
No,
Okay, your vaccine is up to date?
they are.
Yeah, good. Keep it up. And do you
you.
take any herbal or supplement?
No,
Okay, a few questions about your lifestyle because it affects your condition. Do you smoke?
I'm not.
Drink alcohol?
No,
Caffeine?
no.
Do you exercise?
Yeah, I walk like whenever I have energy to do.
Yes, that's good, and keep it up. What about your diet?
2
Yeah,
minutes.
it's well balanced diet.
Well balanced, that's good. If you give me a minute, I'll check my reference. I'll get back for you, okay?
Sure, go ahead.
Can I see the prescription again? Prescription. The prescription. دكتور محمد.
بسرعة روحي شوف الريفرنس.
دكتور محمد
مش سامعك روحي شوف الريفرنس.
لا بدي أشوف I need to see the dose.
one capsule.
Yeah, it's a 20 milli equivalent.
20 milli equivalent. Okay, 20 milli equivalent.
Right. راح يروح الوقت عليك.
Okay.
20 milli.
Give her one more minute, Dr. Mohamed.
Okay. 20 milli equivalent. Do you have a problem with the swallowing? Or
no.
Yeah, okay. This is for a treatment or for a prevention? For treatment, right?
For treatment, yeah, he told me your potassium level is low.
Okay. Okay, so I checked the reference and I have a concern about the dose. The dose should be for treatment 40 millimole per day. So the doctor prescribed for you 20. Okay.
Yeah, he told me he will go with the 20 milligram and then he will do like a lab work and then he will see he may increase it.
Time is up. Time is up.
اوكي اديها دقيقة كمان يا دكتور احنا بوظنا لها الوقت.
Okay, go ahead.
Got it.
Okay, can just I want to see something here. Okay, from where he get hypokalemia? What the problem?
He didn't tell me.
Can I see the profile again, please? He has heart attack, right? Some of this medication. Yeah, he taking diuretics, hydrochlorothiazide. Yeah, he make hypokalemia, right? So
I don't know.
yeah, I have a concern about this medication because if you get hypokalemia due to the hydrochlorothiazide, so I recommend
so time is up once again.
Yeah, so he needs to take 40 millimole to compensate the hypokalemia that's happened from the hydrochlorothiazide. I think it's like that.
All right.
And
is
I
there
will
anyone
text the
else?
doctor.
Okay.
Yeah, I think it's that because it's still the hydrochlorothiazide will keep reducing the potassium level.
Okay. Well, I'll hold you, doctor. He wants to go with this dose, and then there will be like a lab work, and then he will decide whether to increase or decrease the dose for here. Okay, we can get back to you later, but if there's anyone else who would like to go with this case one more time.
I can, if it's possible.
Yeah, okay, let's go.
Okay. Yes. Hi, I'm Dima, the pharmacist. How can I help you today?
Yeah, I'm here to pick up my medication, please.
Sure, my
Hi, I'm
pleasure.
Dr. Mohamed.
Your doctor, it's doctor station?
No.
Hi. Yeah, sure, it's my pleasure. Could you have a seat in our private counseling area? Make sure whatever we discuss will be kept confidential. Can I confirm
Thank
your
you.
name?
Yeah, my name is Jennifer Lopez.
Okay, Jennifer. How are you so far?
I'm good, thank you.
Okay, Jennifer. Can I know for which reason the doctor prescribed this medication for you?
Yeah, it all means for low potassium level.
This must be concerning for you. I will try my best to help you. May I ask a few questions to assess your condition?
Sure.
The profile, please. The profile. Okay. Okay, so I can see from here your profile that you are currently on amitriptyline 10 milligram. For which reason?
It's for my heart.
Amitriptyline.
Sorry, amitriptyline, yeah, it's for neuropathic pain and also for depression.
Okay. And you are currently on ramipril, metoprolol, and hydrochlorothiazide for hypertension or heart? For which reason you are?
Yeah, both. Yeah, for hypertension and heart. Yeah, for my heart.
Is it control?
Yeah, the doctor said yes. My readings are good.
Oh, that's good. And atorvastatin, metformin, and dapagliflozin, and and it is control. I mean your diabetes, your blood, high blood glucose, and your.
I think so.
Use and go. And you take aspirin as a blood thinner
Yes.
and pantoprazole tablet as well, okay?
Yeah.
You take this medication, right? All of this medication.
Yes, I do.
Aside for this medication, do you have any other prescription medication?
No.
A non-prescription medication?
No.
Multivitamins, herbals?
No.
And you're vaccinated up to date?
Yeah, they are.
You have any allergy?
No.
About your lifestyle, do you smoke?
No, I don't.
Do you follow any specific diet?
Yeah, I eat very well balanced diet.
Balance, that's good. That's good. Do you have time for exercise?
Yeah, I walk every day for like 30 minutes whenever I have the chance.
Oh, that's good. That's good. What about your alcoholic, alcohol and caffeinated beverage?
No, I don't drink any alcohol or coffee.
Oh, that's good. Okay, let me check my reference and come back to you.
Sure.
Oh, okay. Can I see the prescription again, please? Yeah. Okay, thank you for waiting. Yeah, I have a concern here. Yes, the doctor prescribed for you potassium chloride 20 micro EQ potassium tablet. But before I dispense of that medication, I want just to bring to your attention that you have a low potassium level because you are currently on multiple medication that put you at risk of the low potassium level in your body. Such as hydrochlorothiazide and protein pump inhibitor. Can I see the medication again? Yeah, and pantoprazole tablet and hydrochlorothiazide, okay, and ramipril. All of that medication can decrease the potassium level in your body by as a diuretics can decrease the level of the potassium. So no problem. I will fax the doctor to put him in the
I
same.
was discharged this morning from the hospital, and the doctor went through all my medications and asked me to keep using all of them and just add this new one.
So in the hospital, did you start any new medication in the hospital?
No, the doctor just like put me on this new one, which is the potassium, which I'm here today to pick it up. And he told me to keep using all of my prescriptions as it is.
Okay, only the potassium is in your medication. The other medication you are before, you are taking before,
Yeah.
right?
2 minutes remaining, 1.5 minutes remaining.
Okay. So yeah, I want to prescribe dispense the medication, but bring to your attention that like you have medication that decrease the level of the potassium in your body. So the doctor prescribe for you potassium. You want to take a 1 tablet, but please monitoring yourself. This medications you're gonna take this medication without food. If you have some side effect from that medication, like nausea, vomiting, try to take with food. Maybe you have a diarrhea. It is just keep hydrated. If you have a headache, take Tylenol 1 to tablet every 4 to 6 hours at maximum days. 4 milligrams. Yeah, along the benefit of this medication, there is you have a good lifestyle. Keep it up. Just to try to increase food contain the potassium in your diet. You can follow with the dietitian to tell you more about it. Okay. And please
Right.
keep monitoring yourself. Can I call you after 1 week to see how you are doing with the medication?
Yeah, sure. Thank you.
غلط.
Yes. Okay. Look, whenever you have like a new prescription for a new medication and there's like a patient profile in front of you, you need to make sure there is no drug interaction between the new prescription and the medications the patient is already taking. You need to go directly like to the drug interaction section. Usually it's like the first thing. Just to make sure there's no drug interaction, like major drug interaction between the new prescription and the prescriptions already on file. There are a lot of cases in the OSCE exam just like this. Like there's always a new prescription and there's like a certain kind of drug interaction which needs to be adjusted somehow, like the propranolol and some headache medication, for example. So if you go here, if you go to the reference and if you go to the drug interaction table,
Yeah.
can you spot anything?
Yes, I go, but you can give it with monitor.
Ramipril
Sorry.
increase the potassium.
Ramipril increases the blood pressure.
Just
potassium.
Ramipril?
Dapagliflozin.
Diabetic medication also.
Dapagliflozin.
Daba.
Is there anything else?
Yeah, anything else? ACE inhibitor.
It's written in the reference anticholinergic can increase the
Yes.
potassium.
No, not like this. It's anticholinergic, yeah. It's the anticholinergic issue, but not increase the potassium. Can you go to the drug interaction table in the reference in the monograph?
I already on it, but I
Yeah.
didn't see anything. Like an agent acting on renin antagonist system, like alkazapine, captopril, lorcaserin, ciprolactone. You can give it all of the anticholinergics. The patient didn't have any anticholinergic in his profile.
Anticholinergic is amitriptyline.
Amitriptyline.
Is a medication which has a very, very strong anticholinergic side effects. If you go to the table in table number 2 in the reference, drug interactions,
Yeah, I saw.
anticholinergic drugs. If you go to the anticholinergic drugs, if you see the effect, anticholinergic medications can slow down the GI transient time and may increase the risk of potassium-induced GI lesions when solid oral dose forms of potassium are used. Just when solid oral dose
solution
form are used. So what is the clinical comment? Avoid concomitant administration with solid oral dosage forms of potassium. Liquid formulations may be preferable. And the patient here is already on pantoprazole for previous ulcer. So she's even at very high risk of this drug interactions. Actually, if you look up this drug interactions in lexicon, it's contraindicated to use amitriptyline with a solid form or
But the
tablet
comment
form
here,
of
doctor,
potassium.
you can avoid it if possible.
Yep, and it's possible to do it.
Yeah, it's possible.
You have, if you go up in the reference to the dosage forms available, we have potassium as liquid form, potassium
Yeah.
chloride as oral liquid form,
2
millimole potassium per 15 ml.
Yeah, so we need to change the formulation.
Yes, you need to change the formulation because the patient already is on pantoprazole. Patient is 70 years old, so she's already has a very low GI motility because of her age, and she's on pantoprazole to protect her stomach because of previous ulcer. And now she's on amitriptyline and she cannot stop amitriptyline, and you will add potassium. And you know what? One of the most common side effects of potassium supplement is GI ulcerations. That's why we usually tell the patient after using potassium supplement to stay in upright position for at least half an hour. Do not sleep or lie down for at least half an hour to avoid any ulceration. in his stomach. It's like doxycycline recommendations and other medications. So there's a very, very high risk for this medication to cause stomach problems. So we need to switch the patient to the liquid dosage form. This
So
is the only
the
trick
problem
in this.
only for amitriptyline.
No,
And what about the Ramipril? It's
Yeah,
still
but
with
the
the
ma-
oral, with the liquid dosage form, the Ramipril is still okay?
Okay, but the main concern is amitriptyline. So we need to change the formulation because the amitriptyline, not for other drugs,
Yes.
Yeah, just
right?
change the
Yeah.
formulation because liquid form will just go directly from the stomach to the intestine. It will not stay in the stomach for a long time.
Yeah, just for amitriptyline
Just for
anticholinergic.
amitriptyline. You
Yeah.
don't have to worry
Okay.
about the reason behind the low dose or the low potassium level. Ramipril actually can cause hyperkalemia,
Yes, yes.
Mm.
and hydrochlorothiazide can cause hypokalemia.
Right, yeah.
Yeah, so we don't have to worry
Oh,
about
that
that.
is balance. Okay, okay, I got it.
Yeah, we don't have to worry about what is the reason behind hypokalemia. The patient already, the doctor is satisfied with the patient profile and medications, and he just wanted to add a potassium to level his potassium level, and that's it.
Yeah. No,
And that's it. He doesn't want to change anything regarding his medication because it's quite hard actually to control patients' medical condition like heart failure. So you can just like add something to correct the potassium level or sodium level or whatsoever. You don't have to stop like the something. So the only trick here is just to switch the patient from the tablet form to liquid form. So how can you do it? So the doctor now wants to give the patient 20 milli equivalent potassium as tablet, and you
Yes,
will change him to
is,
the liquid. So how
there is
many?
liquid, yeah.
Yeah, how
15
many?
ml.
Use it.
Yeah,
15
with the
ml.
millimoles.
15 ml.
You will give her 15 ml,
Yes, 20 millimole potassium.
and
There
is 20
15 ml.
millimole is equivalent to 20 milli equivalent?
Yes, it's millimole. It's equivalent, milli equivalent.
Okay. And can you tell me
Millimole, it's milli
where I
equivalent.
can find this in the reference?
Yeah, in the summary of product information.
Summary.
Yeah, but
So you are 100% sure that millimole is the same as milli equivalent?
Yes.
Okay. You're right.
Yeah, this is
But it's
from my
not in the
mind.
summary.
It's not written, but it's in
yeah,
my
it's
mind.
not there, but it's equivalent.
No, it's written actually in the reference. That's why
Where?
I'm asking you to check this, and you shouldn't depend on your own
Yeah.
memory. If you go like in table 3, elemental potassium content, okay, at the end of the table, 1 gram elemental potassium is equal to 25.6 milli equivalent, which is equal to 25.6 millimole, which means the millimole is the same as milli equivalent.
Yes.
Okay.
So you're
Okay.
right. So you give the patient 15 ml.
I asked you from the beginning, do you have difficulty in swallowing? If you say yes, it's salt.
I know, but it will not be like this. Yeah,
Okay.
usually like in the exam, if there is like a new, like in my exam, there was like a case when the doctor prescribed for the patient the Entresto, and the patient was actually on Ramipril. And the patient didn't say anything, didn't mention anything. And there's a clear drug interaction between Entresto and Ramipril, and it was clearly mentioned that the patient has to stop using the Ramipril for like 36 hours before switching to Entresto.
Yeah.
So if you just go and tell the patient, well, you need to stop using the Ramipril and start using the Entresto without mentioning the 36 hour, the case is failed. So usually when they're like a new medication and there's like a patient profile, you need to check the drug interaction. The same with, as you remember, the propranolol and the migraine medication, I don't remember the name of this medication. Propranolol may increase the area under the curve of this migraine medication by 40%. So you need to decrease the migraine medication by 50% or 40%.
That's rizatriptan.
Like this, yeah, rizatriptan, yeah. So you need to check the reference for drug interaction whenever you have like a new medication. And here you can use your extended scope of practice because you are not changing anything. You will give the patient the same medication, same dose, but in a different dosage form. Instead of tablet, you will switch him to liquid. And instead of one tablet, you will give him 15 ml. Is that clear?
Yes, nice case.
Okay. Yeah, that's it.
Okay, sounds good. Perfect. Let's move forward. Let's have a fifth station, guys. Are you done, Nizam?
Yes, sir.
That
Yep,
assessment,
I am.
everything is good. Okay, perfect. So let's move forward, my friends. One moment. Who's next?
10% is 1.95.
What?
Sorry?
What do you say? Okay, who's next, guys?
Okay.
Oh,
I think they are tired.
I don't know. Would you like to move forward or what?
Yes.
You would like a fifth station or that's
Yeah,
enough for
we,
today?
Yes,
we-
please.
yeah,
Yes.
yes.
Okay, so who's next? I can see Amber. Amber, you're done already, right?
No, you can give me, but my problem is that your references are not opening on my Telegram.
Why? No, this no, yeah. This one, the reference is very important. So make sure that you can open it.
I can open it on my CPS if you want.
No, it's not available on CPS. It's
Okay.
like external reference. Okay.
Okay, I
Let's,
can do it.
anyone else, guys, who one from the colleagues who didn't do any station today? Ozma, you have done one already, I think. What about the others? I can see Amadi, Andrew, Riham, Sabi, Sarah. Okay. Anyone, guys? Okay. So let's move forward. Okay, no problem. We have okay, so now we have Ozma, Heba, and we had Amber. Amber, if you have a problem opening the references, so you cannot do this station because the reference is very important.
Yeah, I am so sorry. It's not opening. Yeah.
Okay, so we have Ozma and we have Heba for now. Okay, I'm gonna send you the reference. Can you see my screen or what? Not yet, right?
Not yet.
One moment. You can see it now?
Yeah.
Okay, sounds good. Let's go.
Mhm.
Okay. Nizam, can you please watch at the time? Ah,
Yes,
the
sir.
reference
Did you
was
send the
here?
reference already?
Yeah. I have just sent it. Okay.
Yes. Okay.
Who will make the case?
Yeah. Who will make the case?
Okay. Ready? Station
I
number
think
5.
Osman, maybe.
Yes.
Oh,
I
okay.
didn't get the reference yet.
One moment. It's 65%.
Oh, it looks like a
70.
big reference.
No, honestly, no. It's a very easy one. Another straightforward station.
Understand.
Mhm.
Okay. You should have it now.
Oh yeah, I got it. Just
Okay,
one.
perfect. So let's start. Nezam, 7 minutes, please.
Okay. Yeah. Go ahead.
Let's go.
Hi,
Yeah.
my name is Isma. I am the pharmacist on duty today. How may I help you?
Yeah, my name is Susie. I'm 37 years old and I'm looking for a consultation from the pharmacist.
Yeah, sure. I can help you with that. Please have a seat here. This is our private counseling area, and everything we discuss here will be kept confidential. Okay.
Yeah.
Can I confirm your full name and date of birth, please?
As mentioned, Susie McConnery. I'm 37 years old.
Okay. So, I can see your profile here, Susie. You are not allergic to anything. Is still the same?
Yeah.
Okay. And
No,
you are
I'm allergic to penicillin, pollen, and ramipril.
okay. I will update it on your profile.
Mm-hmm.
Okay. And you are taking a few medications, the irbesartan 300 milligram, amlodipine 5 milligram, and you are taking the suppositories, celecoxib, Xylogen. Is that information is correct?
Yes, correct.
And you are here today for the over-the-counter medication?
Yep.
Okay. So can you tell me about your symptoms, which medication you are here for?
I need an over-the-counter medication for hemorrhoids. I have been using like several medications like preparation H, anuzole, and many other medications, but nothing works. So I would like to have like your consultation.
Okay,
Or
sure.
if you have any proposal to me or something.
Okay. Is it okay? I will ask you a few questions.
Yeah.
Okay. Did you when your symptoms are started?
Now the problem started 1 year ago, and
Okay.
I suppose I'm planned for a surgery in the coming few months, but I'm
Mm-hmm.
not aware when.
Mm-hmm.
But yeah, it started like 1 year ago.
Okay. And did you notice any pain over the area, hemorrhoids?
What do you mean?
And did you feel pain and itchiness on the hemorrhoid area?
Yes, that's why I'm here.
Okay. And did you notice in the blood in the stool coming out?
Not so frequent.
Okay. And did you notice the pain inside the bump or outside the hemorrhoid?
The pain and inside. It's not so much inside, about more outside.
More outside. Okay.
Yeah.
Okay. And did you notice any constipation as well?
Yeah, it's worse. It's
Okay.
worse during constipation.
Okay. And is there any pain in the stomach, pain in the abdomen as well?
Stomach, no, I don't have.
Okay. Okay. And did you see the doctor yet for this condition?
Yes, as mentioned, I'm planned for a surgery.
Okay. Okay. And beside these medications, you are not taking any other prescription medications, right?
No.
Okay. Any over-the-counter medications?
No.
Okay. Okay. So a few questions about your lifestyle. Do you drink alcohol?
No, only on occasions.
Okay. And what about your, did you do the exercise?
Yeah, from now and then.
Okay. So just give me a moment. I will check my reference and get back to you.
Okay, sounds good.
Muted Madhu. A lady presents herself to the pharmacy asking for over the counter. आवाज तो नहीं हो तो बोलता नहीं है जी.
My friend, Okella, mute please. Okay.
Okay, thank you for patiently waiting, Suzanne. So according to my reference and
Yes.
according to your symptoms described, okay, and you told me that you are using the couple of medications already that doesn't work for you, right?
No.
So according to my reference, the nifedipine 0.2% ointment will be a good choice for you, okay? And
Okay.
this will help in relieving your symptoms. Okay. And you can apply this ointment rectally. Okay. And it has shown to be very effective in the treatment of the anal fissures and hemorrhoids. And it is well tolerated with the minimal side effects. Okay.
Okay.
So that's why I would like to recommend this medication to you. But this medication is not available over the counter. Okay.
Oh yeah. Okay.
So I'm going, if you are okay with that, I'm going to fax to the doctor. Okay.
Yeah.
To just give me a moment. Okay, so I'm going to fax to the doctor to give you the prescription for this medication to you. Okay.
Okay.
It will help in relieving your symptoms. The over-the-counter medications available are the preparation H and anosol, which you already used, right? So and it doesn't work for you. So for your condition, the nifedipine 2% is a good choice.
Okay, it will be cream, ointment, suppository.
It is the
form?
ointment. It is
Time.
the ointment, which I already explained you. It is the
Time.
ointment, and you have to. Okay.
Mm-hmm. Okay. Well, okay, my friend. But you missed like some important information. Honestly. Okay, so overall you did well, but there is like some missing information from your side. Okay, so I will tell you as well. Let's continue. Okay. Any other candidate, guys? Would like to retake it?
I will try.
يلا بنت بلادي.
بس انا مش شايفه الفايل اصلا. دكتور احمد ممكن تعمل زوم؟
الفايل بتاع ايه؟
دكتور محمد هيتحكم.
بيشنت بروفايل.
اهو ولا تمام كده؟
تمام شكرا.
Okay, go ahead.
Just okay. Forget about date of prescription. It's like not so good. Okay, so are you ready?
Yeah.
Okay, go ahead.
Hello, I am Hiba, the pharmacist. How can I help you today?
Yes, hey, but the pharmacist, I would like an over-the-counter medication to hemorrhoid. It's
Oh,
been
sure.
like 1
Can I
year.
help you?
Yeah.
Yeah, sure. I can help you for that. Can you please have a seat to discuss further about your concern? Just
Yeah.
I need to ask you a few questions first to assist you better. Is it okay for you?
Sure.
Can I know your name and age, please?
Suzanne McConnery, 37 years old.
Okay, Susan. So can you tell me more about your symptoms? You said you have a hemorrhoid. Can you describe what symptoms you have now?
It's very painful. Yeah, it's very painful.
Oh,
And it's been like 1 year that I have that. And I saw my doctor, and he put me on the schedule for a surgery within the coming few months.
I'm so sorry for that. I can understand how it's bothering you, but I will do my best to help you. So did you try any medication for hemorrhoid before, Susan?
Yeah. I tried so many. I tried Anazole, the preparation H, and I have one in my file, but nothing works.
Okay. Are you by chance pregnant or breastfeeding?
Yes, I'm pregnant since like 1 week.
1 week.
Yep.
Okay. And how's your feeling in pregnancy?
It's good. It's like my second child.
Oh, okay. I hope you complete your pregnancy with good health. So,
Yep.
can you describe if you have any like bleeding or just pain?
Bleeding, yes, it happened before about 2-3 times. Pain, it's as mentioned, is very painful.
Okay. Do you have any allergy?
Yeah, penicillin, ramipril, and pollen.
Okay. And I see that you take ibuprofen. Can I know the reason for that?
Blood pressure.
Okay. Is your doctor aware that you are pregnant now?
No, not yet.
Okay. And you take amlodipine for what reason?
Blood pressure.
Okay. Celecoxib?
For pain.
Okay. And do you still take this ointment, xylocaine also?
From now and then.
Okay. Thank you, Susan, for all this information. Just I need to confirm any change recently in your lifestyle for eating. Did you take any new type of food may affect your condition, like spicy food?
No.
Do you drink any alcohol, any caffeine?
No.
Okay. Thank you, Susan. Just give me a second, check my reference and back to you.
Okay.
Okay, thank you for waiting, Susan. Actually, what's the symptoms you started to have maybe from previous symptoms you get before, and also starting a pregnancy may affect your condition. Besides that, I see that you take some medication for your blood pressure. Just I need to confirm if your blood pressure is controlled.
Yeah, no, not so well, but yeah.
Yeah, but I
Not
have
so
a
well
concern.
controlled.
Yeah, I have a concern that this medication should be changed in pregnancy. Because first one is ibuprofen is not indicated during the pregnancy. It will be harm for your baby. So is it
Good.
okay to see your doctor today?
Today, no, not possible.
When you can see your doctor?
Maybe Tuesday, maybe in 1 week or something, 1 or 2 weeks.
I prefer to be early, actually, because you start to be pregnant. So this medication maybe harm your baby. I will fax to doctor and document in your file. But it's better to, if it's not possible to see your doctor, you can go for walk in clinic. Okay.
Okay.
Okay, and for your condition, I prefer to start it, follow some self-care measures like use a CT pass, use it 3 to 4 times per day. Okay, and you
Okay.
already use xylocaine. This is anesthetic medication, give you like relief for pain. Beside that, I can compound for you nifedipine ointment. This is for hemorrhoid. Okay,
Yes.
you can mix with the xylocaine.
Okay.
Use it twice per day to relieve this pain until you go for walk in clinic.
Okay.
Okay, and I see also you take celecoxib. I see also you take high dose from celecoxib, Susan. So it's bit. You said you take it for pain, right?
Yes.
We start to the first week for pregnancy to be safe. I recommend to hold the celecoxib, and you can take Tylenol. It will be better than take celecoxib during the pregnancy.
Okay.
Okay. Otherwise, Susan, you can increase your fiber intake, increase your fluid. As I mentioned, you can use a CT
And for medication, you're not going to give me any medication?
Yes, I will compound for you the nifedipine ointment.
Okay. You will do it now?
Just give me 30 minutes. If it's possible, you can go and I will deliver it for you.
Okay. Good.
Okay. You will use it twice daily. When you use it, you can start to feel some itchiness, irritation, but this is normal. Use it until you see your doctor.
Perfect. Thank you so much.
Thank you.
Good day. Bye. Okay. So done. What about the time? Nezam, are you still with us?
Yes, sir, I am.
Come
And
the
it's 7 minutes now.
Okay, good. Okay. Okay, Heba and Ozma, thank you both so much. Heba, you did very well, honestly. But why did you dispense the nifedipine?
انا ما كنتش هصرف والله، بس ما اعرفش ليه حبيت اجود. المفروض ما اجودش من عندي، انا في بالي ما اصرفش بامانه يعني، ما كنتش عايزه اصرف.
Nifedipine is not an over-the-counter medication.
ما هو في كومباوندنج ومكتوب ان احنا ممكن ندور عليه اونلاين او جوجل وكده، فانا قلت اعمل لها خدمه
No, nifedipine is like a prescription medication.
ماشي
Yeah,
تمام.
okay.
ماشي.
So yeah, nifedipine is like okay, it's good choice, everything, but you cannot prescribe yourself.
Yeah.
Okay. Apart from that, you did very well.
Thank you.
Everything went very good with you. The assessment, questioning, everything, and as well, thanks to Ozma. Yeah, okay. She did as well a very good assessment, but she didn't ask about pregnancy. Okay, which is like very important here. She missed this. And what else, Ozma, you did? Yeah.
I didn't address the irbesartan as well.
Yeah, irbesartan. I didn't ask about the hypertension. Is it like controlled or not controlled? And you didn't recommend any over-the-counter medication. What about constipation? And for constipation as well. Okay.
Yeah, I was about
You
to
asked
recommend
about
that.
Ozma, you asked about constipation, but you didn't propose anything for it. Okay.
Sorry, where in the reference I can see it's a prescription medication?
Nifedipine usually. I think it's in the reference. I don't know if it's in the reference or no, but it's nifedipine. Nifedipine is a medication.
Yes,
like
but I didn't. If I don't, I
do
don't
you
have
have? Is it
experience.
mentioned that you can dispense over the counter?
I see here in the
If you can find it in the reference, so you are fine. If not, so yeah, it's, you should know that nifedipine is like prescription medication.
Here, right, compounding pharmacy. If you don't live, just a second, please. We suggest copying. It's a compounding, but he didn't mention anything about prescription.
Okay. Compounding.
And for the
Anything about
constipation, we
over the
can.
counter? It's not over the counter, neither. Correct?
It's don't mention in the reference, doctor.
Compounding
Not
need
mentioned?
need a prescription as a
Usually,
compound.
doctor, any compound product needs prescription.
Okay, it's good to know before exam.
Yes.
Thank you. Yeah.
Not any compounding. Some compounding, yeah, some compounding you can do it yourself, but usually nifedipine is like a prescription medication.
طب يعني ما كنتش صرفته لك كنت حليت الكيس صح؟
Yes.
She has a constipation as well.
Yes, I
Exactly.
advise her to take fiber intake, increase fluid.
Yeah, mom, not a constipation.
Constipation, my friends.
طب الكونستيبيشن بندي علاج يا دكتور ولا بندي نون فارم بس؟
لا ممكن you can give Ducozat. You can give Ducozat sodium. You can give Laxaday to prevent
Okay.
over-the-counter and safe medication even with pregnancy.
طب أنا عندي سؤال معلش.
Lifestyle as well is good.
Okay. طيب if I don't have any medication on the table in exam, so and I have a reference contain some medication, I can recommend direct from reference or should I have some on the table?
No, you can recommend. Why you should have? No, you can recommend. If it's indicated and well indication and it's like very well suited to the
Okay.
case, yeah, you can go.
But no the medication on the table, so that's okay?
Yes.
Yes, they get like the last exam, we give it us first bite and there is nothing in the table and we have to give it naproxen.
Okay, thank you.
Okay. So yes, this is normal. You can recommend. Okay, guys. Is it clear the station? It's not so much tricky, right? It's a direct one.
Yeah, دكتور يعني my exam next week but confused. We are confused inside the station.
Why?
مش
No,
عارفة.
no.
أنا حتى اللي خايفة
Do not
من
get
الامتحان.
confused. Do not get confused. It's like easy one. It's an easy one.
Yeah, easy one, but when we are talking, we start like I didn't see anything. And even for my mistake, I thought like a hydrochloride can decrease potassium, but why decrease potassium? I know it's like it increase the potassium. Like I make misinformation, overlap everything inside this when I'm talking, but when I'm out the station, just I know everything.
Yeah,
These things can
just
happen.
relax, doctor. Just relax.
Correct. These things can happen. You don't worry. And the assessors understand that.
Yeah.
They understand that.
Yeah.
Okay. So don't get so panic. So everything will pass. So but just be confident. Confidence is very important. You have to express confidence. Okay. And that you are sure of the information you provide, your messages should be like clearly communicated. This is everything. But don't worry about like if you give like some misinformation that may not hurt they may not cause any harm or hurt to the patient. So don't worry about it. But the main concern of the case has to be solved. You have to address the main concern. Okay.
Okay.
As I mentioned, I'm usually telling that like OSCE is easier than MCQ. Is manageable. It's more manageable, not easier, but it's like more manageable than the MCQ. You can manage the OSCE station better than any MCQ questions. Qualifying. Okay.
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 You'll be
Welcome
fine,
back.
guys. You will pass. You're so
Yeah.
good.
You're so good. La,
We are
today
doing
you're
mistakes.
good.
I'm
We
sorry?
are doing we are doing so many mistakes.
Yeah.
But you're still so good, and just for your information, the exam is way easier than our stations.
Yes, this is right.
Yeah, it's just like our
Like,
stations is trying to trick you and make you like use your
provoke you.
all your brain
Try to
cells.
provoke you.
معلش أنا
Provoke.
عندي سؤال لو امتحان بعد
One moment, I
الظهر
will stop the recording, guys. One moment.